Residents along Western Australia's Kimberley coast have begun picking up the pieces in the wake of Tropical Cyclone Ilsa that crossed the coast yesterday morning. The Pardue Roadhouse and Tavern, a key pit stop for travellers, experienced the brunt of the Category 5 system. Well, joining me live is Judith Barker, the CEO of the Royal Flying Doctors Service. Judith, thank you so much for joining us. Yes, as we know, a Category 5, the strongest cyclone to hit in 14 years. A lot of areas were spared the damage, which was fantastic news. Pardue Roadhouse, unfortunately, copping the brunt of it, and many other regions as well. But how has the operations from the Royal Fire Doctors Service been in this operation?
So we started preparing before Easter. And we had to prepare several plans, both for Broome and Port Hedland and everything in between, because the cyclone at that point was so unpredictable. But as we got closer, our incident management team firmed up the plans, and we ended up needing to evacuate our planes, our pilots, our nurses and doctors from Port Hedland, so to areas such as Broome and Truscott, so they could continue to respond and to ensure that our planes and our team were safe.
And you mentioned you prepared before Easter. I mean, it is such a big thing, isn't it? We get the warnings from meteorologists and experts, you know, indicating the cyclone is coming. They are unpredictable in terms of their movement and their intensity, as we all know. And yes, you just have to do all you can, which is, of course, extraordinary work, and then leave it up to where the cyclone lands. And like we said before, a lot of places, including Port Hedland, were very lucky, not all, but certainly the brunt of it moving further north.
Yeah, I think everyone, I have an amazing team in the Royal Flying Doctors, and they put the plans into place, so they were ready. And we work closely with police and fire, so everybody was ready. But we are all eternally grateful for the fact that we came through this largely unscathed for what it could have been for a level 5 cyclone.
I can't even imagine you and your team and what you would have to deal with in circumstances like this, but having that outcome where it was a positive one in your instance, and again, not excluding what has happened, it must be such a relief.
It is such a relief. And look, we were evacuating some quite unwell patients from communities before the cyclone hit. And unfortunately, people still become unwell during cyclones. So once it passed, we knew that we needed to assess who was there, who needed to get out as well, because you can't move patients during the cyclone. And so my team's going to spend all weekend moving those patients around to get the care that they needed. So a lot of those will come down to Perth. But we're really grateful. The runways are still open, the planes are still flying, and our team is safe. So that means we can do that.
And give us a bit of a snapshot, if you don't mind, on some of the amazing work that you and the team do, generally speaking.
I'll say the team do the amazing work, and I just like to think I support them. But, you know, our team move patients between hospitals. They bring them down to Perth to get the care that they need, that they can't get in rural and remote Australia all the time. They fly out. They are those crews that you will see landing on the highway at severe traffic accidents and making sure that people are getting to the hospital, that they're getting the trauma care they need. And more than that as well, our crews go out to communities and stations to do the primary health stuff, to do GP clinics, to do antenatal clinics. So our team look after WA on the worst day of their life, but they also look after them when they just need a GP, when they need those simple things. They do an amazing job of being there for rural and remote WA.
Well, thank you so much, Judith Barker, CEO of Royal Flying Doctors Service. And yes, we will continue to keep a close eye. It's still a tropical low, so it still has been bringing some wild weather, a lot of clean-up for a lot of areas. But thankfully for many other areas, it certainly has been positive news. We'll talk to you again soon.
Thank you so much.